There has been a lot of debate about the deployment of Cuban doctors into the country. Well, I think that was a very good move by our government. These are doctors that are known to be specialists and experts in preventative medicine. South Africa needs to apply proactive methods before we can reach our peak. This is simply because we do not have adequate health facilities with proper infrastructure. Again, I'm 100% behind those that say frontliners must be given danger allowance, and all frontliners, starting from a cleaner to a doctor. A COVID fund can be used. This is why the president has announced a COVID fund relief. These are the things that should be used to ensure that a danger allowance is paid. But who should advocate for that? Unions. Unions must make sure that they put pressure on government the very same way that they did with PPEs. There's also an issue about unemployed doctors. Why is it that we have qualified doctors that are not working? Is it because they are not applying? Is it because they do not want to work for the public sector? Or is it because they do not want to be deployed to rural areas somewhere in the northwest? Well, we need clarity and transparency on that, because the little knowledge that I have is that one doctor in a public institution can attend to more than 100 patients. Why is it like that when we have qualified unemployed doctors? There's also an issue that there's the money that will be paying Cuban doctors. If there's money, why not? They need to be remunerated for their labor. Why should we exploit them? This is a country that has survived 50 years of imposed sanction from American and European countries. If it means we need to channel the money to them to boost their economy, why not? After all, they would have paid or been paid for the job that they would have done. There's also an issue of language barrier. I personally don't think that the language barrier nullifies the fact that they are experts and they are specialists. Have we ever thought that the government not only spent money on those Cuban doctors? Let's think of the repatriations that took place during this outbreak. South Africa, the state, has spent money for travel, for quarantine accommodation, testing, and ultimately taking those that were repatriated to their respective homes. I would believe that the COVID fund was used because it is used during this kind of events. During his interview with SABC News Channel, a health activist, Dr. Kgosile Tlhape, said he was in Cuba between January and February. And at that time, Cuba was busy preventing the spread of the virus. They were testing their citizens, regardless of whether they had travel history or not. They were busy preventing the spread of the virus while we were busy focusing in China. Cuba was preventing, and this is the reason they have recorded the lowest positive COVID-19 cases. During the Department of Health technical briefing, Dr. Mkhize said, South Africa is going to work together with Cubans. And he raised a very important and interesting aspect to say the model that we use as South Africans is different to that of Cuba. In South Africa, we use a method that says you get sick and then you go to a hospital. Whereas in Cuba, they use a method that you get sick before you can get sick and only be taken to a hospital when it is necessary. Further, Prof. Shishana said, South Africa is ranked in the top 5 globally for countries that have responded positively to the virus. But she said, we are not yet out of the wood. Will Cuban doctors assist us to maintain the momentum? Well, it remains to be seen. I am Immaculate Saint.